Assalamu alaikum wa rahmatullah. Thank you everyone for coming, especially so early. As an intensivist and a physician in acute medicine, I frequently have to make decisions about resuscitation almost on a daily basis when I'm doing my clinical work. And when I have these sort of resuscitation or do not resuscitate type discussions with patients or their families, and if they happen to be Muslim, then one of the first questions they ask me is, well, are we allowed to say, do not resuscitate? You know, do we not have to do everything we can in our power to save life, preserve life? And so, alhamdulillah, I have had an opportunity through this Fiqh of Medicine course to gain some sort of understanding and background to answering that question. And some of that summary I will try and present to you. So this will be, this is sort of the outline of the brief talk. We'll talk about what resuscitation is. We'll talk about DNAR decisions, which is do not attempt resuscitation. We'll talk about that from a sort of Islamic point of view, and we'll conclude. So, I'm sure most of you may have seen resuscitation, some of you may not have, so this is a brief. So you can see that resuscitation is taking place here. There's someone, pressing up and down on this patient's chest. He's most likely breaking some ribs. He needs to go down to a depth of 5 or 6 centimeters. There's someone, top end, putting a tube down this guy's throat. As the resuscitation is going on, you can see him moving his legs. As his blood perfusion improves to the brain, he is becoming awake and moving around. But during that time, someone is putting his hand in his groin, as you can see. That's not in a dodgy way, but it's to feel a pulse, just to make sure the resuscitation is successful. The patient is almost fully exposed. Frequently we have female patients, and the chest and the whole patient is completely uncovered because we have to put leads on, we have to put defibrillator pads on, we have to feel for pulses. So it's a very, very undignified process, resuscitation. And as you can see, there are some harms to this process as well. So when we think about CPR, cardiopulmonary resuscitation, as what we just saw, we clearly want to preserve life, and that's the reason why we want to attempt to do it. However, we need to think about preventing harm. We need to think about preserving dignity. And clearly, if we are very likely to preserve life and be successful, then some of these other factors may be mitigated. However, these are the considerations that we have to go through. Patient autonomy. So, of course, if a patient does not want to be resuscitated for whatever reason, then I can't even touch them because that would be assault. So I have to take that into consideration. And we have limited resources, and if a resuscitation team is working on this patient, then elsewhere in the hospital they will be delayed if another resuscitation goes on, a cardiac arrest occurs. And so I need to use my resources in the best way. So from a GMC point of view, the General Medical Council, when we talk about do not resuscitate decisions, they suggest that do not resuscitate decisions should be taking place in a few scenarios. So if a patient, as we just said, if a patient does not want resuscitation, then clearly we will not resuscitate them, whatever their reasons are, whether it's likely to be successful or not. But if they do not want to be touched, then we will not touch them. Or if the physician or the medical team looking after these patients, if they feel that resuscitation would not be beneficial. Just like if a patient comes to me, if I'm a general practitioner, comes to me and says, I want antibiotics, then I will only prescribe antibiotics if I feel that that treatment will benefit them. They cannot demand treatment, but they can refuse treatment. If I prescribe antibiotics, then they say, well, no, I don't want to take it, that's fine. But they can't demand steroids or treatment or antibiotics or any other medication for that matter. Similar, it's the same issue with resuscitation. They cannot demand resuscitation. Obviously, it's a sensitive topic, and therefore we will discuss it with them and the family and try and explain to them our reasons for making this decision. So, from a GMC point of view, if we feel it's futile or the harms are greater than the benefits, then we would, after discussing with the family and the patient, make a decision of do not resuscitate. So, from a Sharia point of view, again, preserving life, we'll talk about that. Do I need to seek treatment? Or as a doctor, do I need to give this type of treatment, resuscitation? We'll talk about that. Not harming patients, above all, do no harm, a very important ethical principle in medicine, as well as in Islam, and patient autonomy. So, preserving life. I'm sure most of you have seen and probably know this ayah from the Quran better than me, that states in the Quran in Surah Ma'idah that, to the nearest meaning, that if anyone saved a life, it would be as if he has saved the life of all mankind. Okay, that speaks for itself. Then if we look at the Maqasid of Sharia, which actually, from the classical scholars, they have looked at the commands of Sharia, they have looked at the Quran, the Hadith, the sayings of the Prophet ﷺ, and they have taken out what they feel are the higher objectives of Sharia, and have listed these as 5 or 6. So preservation of the religion, preservation of life, preservation of lineage, family, preservation of the mind, the intellect, and of wealth, property. And so, again, that sort of speaks for itself. Preservation of life is very important. Must I seek treatment? So this is the important part of the talk. That this is sort of a framework which has been derived from the work of fuqaha, Islamic jurists, and have come to sort of a guideline that if you feel that treatment is mutayakkin, meaning almost 100% certainty of cure, then we have to give it, and as a Muslim, we should take that, because there's 100% certainty. It's like eating and drinking, that if a person stops eating and drinking and as a result becomes weak and emaciated and is voluntarily choosing to do that and as a result dies, then they may be sinful. However, if we come to madnoon, which is sort of a probable or expected cure, sorry, moving on slide. Sorry, so this is sort of a framework, as I was saying, taken from the Islamic jurists, that if you have sort of 100% certainty of cure of a particular treatment, then we would be obliged to take it, just like eating and drinking. If it is sort of a probable or expected cure of around 50% or more than 50%, then this is where most of our treatments essentially lie. And we would say that this is not sinful if refused, because it's not certainty. You're not certain that you're going to be treated. You're going to cure this illness. And so it is a sunnah of the Prophet ﷺ, a practice of the Prophet ﷺ. He recommended seeking treatment. And if we have sort of less than 50% certainty that this treatment may or may not work, or it's less than 50%, then it may be sort of non-evidence-based therapy, like herbal therapy, although some of you guys may disagree with that. But of course, it's permissible to use. But certain scholars would even say that actually you should leave that and have tawakkul in Allah subhanahu wa ta'ala. You should rely on Allah subhanahu wa ta'ala alone. And this is just sort of further divided a little bit more. But I'll move on. I know Dr. Rafaqat is pressing me for time. In Fatawa al-Hindiya, which is a fiqh kitab, a Hanafi fiqh kitab, if a person basically did not take treatment, just another example, that if a person had an illness and they did not take treatment and they became weak and subsequently died, they would not be sinful. However, if a person was not eating and drinking and as a result became weak and died, then they would be sinful. Next slide. Having said that, if a patient has a cardiac arrest in a hospital, what percentage of those patients do you think would survive to discharge? Less than 20%. Much less than 20%. 20% is sort of an overestimate. So that would essentially come, next slide. That would come into, carry on. That would come into sort of your sort of less than 50% by far. And so what I'm trying to sort of illustrate is that resuscitation is not a treatment that we must give or we have to give or that the patient has to undertake. So in conclusion, I'll rush ahead to the conclusion that basically unless there is an obvious cause, an immediately treatable cause of that cardiac arrest, and CPI is unlikely to be successful. Unless there's an immediate sort of reversible cause, resuscitation is unlikely to be successful. And CPI has many harms, and therefore, not only is it allowed from an Islamic point of view, but most of the time it is recommended from an Islamic point of view. Thank you very much.